Good evening. Thank you for joining Hillsborough County League of Women Voters. And as we're glad that you joined us this evening, and we're going to learn more about the healthcare for the underserved market in our communities. In May, we had Jean Early, Director of Healthcare Services for Hillsborough County, and Dr. John Curran, who's the chair of the Healthcare Advisory Board for Hillsborough County. They explained the Hillsborough Healthcare Program and services that are available. Tonight, we're going to learn how these services are navigated. Katie Rodders Turner is the Executive Director of the Family Healthcare Foundation. It's a statewide nonprofit navigation program based at the University of South Florida. Katie has over 15 years of healthcare and human services experience, and she leads a team of skilled navigators, all committed to enrolling residents into the healthcare coverage programs. How do they achieve this? How do they do this? Well, that's what we're going to learn tonight. So thank you, Katie, for joining us, and take over.
Thank you so much. Thank you for the opportunity to present this evening. We're so fortunate. And I know all of the great work that the League of Women Voters has done on healthcare reform and convening and championing healthcare related policy issues. So thank you. It's a great opportunity. So the Executive Director of the Family Healthcare Foundation, and I'll share just a little bit more about what the Family Healthcare Foundation does. We are a nonprofit that has been working in Tampa Bay for almost 25 years. And so our focus area is really Hillsborough, Pasco, Pinellas, and Polk. And the goal truly in our vision is that every person in Tampa Bay has equitable access to affordable healthcare coverage. And our mission is to be a trusted leader in ensuring people have access to that coverage through whatever publicly funded healthcare program they may qualify for. And here you have a couple of our navigators. We've grown a lot over 25 years. I'll share a little bit about how that growth has happened. But this is some of the team that works within our area. They're a great group. So we're currently at 16 navigators focusing on 4 counties. I'm going to go ahead and I'm going to switch gears, and I want to just share a little bit more about who these navigators are and what they do and why it's important. And if I can get a thumbs up if everything's going good.
Understanding health insurance should be as easy as a walk in the park, as simple as shooting hoops at the playground. Accessing quality healthcare should be as fulfilling as a well-earned tip, as uncomplicated as Friday date night at home. Everyone deserves affordable, quality healthcare. That's why the Family Healthcare Foundation is dedicated to helping you find a health plan that works, no matter your age, family size, or job status, and at no cost to you. Navigators are here to help, free, unbiased, confidential. We believe in making health insurance easy. We believe in empowering you to take charge of your health. We believe in a community where everyone thrives. Work with a healthcare navigator free of charge to guide you through the process. When children and adults have access to affordable, quality medical care, our Tampa Bay community wins. We're healthy, we're vibrant, we're thriving. Visit FamilyHealthcareFDN.org or call us at 813-995-7005.
So that is just a little video that we put together this last year to showcase how the navigators are helpful and how people can get to us. So, and that's available in English and Spanish as well.
Nice.
So back to the presentation. So I mentioned that we have been around for 25 years. The Family Healthcare Foundation, it's a community-focused nonprofit. We have a good fortune of partnering, though, with a lot of clinical providers, too. But for us in our work, we began in 1998 as a volunteer-run organization, which responded to a call to champion raising a local match in Hillsborough County to bring Florida Kid Care to the Hillsborough County area. So the Children's Health Insurance Program was really just getting its feet wet. There was going through a lot of different changes. It looked very different than it does today. And there was a local requirement to raise funds to show that the community was invested in getting Florida Kid Care to Hillsborough County. So that's what the Family Healthcare Foundation at that point did. But it grew and it evolved. And eventually we became a grantee under USF to provide children's health insurance program, or Florida Kid Care enrollment assistance. And when the Navigator grantees became available under the Affordable Care Act, we also became the Tampa Bay affiliate for the Affordable Care Act Navigator Program. So long before there was a health insurance marketplace, we were already doing, the organization was already doing enrollment assistance work, finding the most affordable healthcare coverage for children, but hearing that the families and the parents needed it as well. We've gone on to engage with Florida Healthy Kids, which is the state agency that administers Florida Kid Care. And we provide assistance for Florida Kid Care enrollment assistance through them as well. In 2017, we were also a recipient of an award that we continue to get through the Children's Board of Hillsborough County, focusing on connecting kids to healthcare after they get enrolled into programs. So not only just getting them access to Medicaid or Florida Kid Care, ensuring that they're getting access to their doctor. And then beyond that, we have done a really, what I think, a phenomenal job with the Hillsborough County Healthcare Plan, providing education and outreach assistance for the Hillsborough County Healthcare Plan. And that is one of our navigators there as well. So navigators are unbiased, free, always providing confidential and objective assistance for any publicly funded healthcare program. And the reason I believe that the Family Healthcare Foundation is so unique and special is because we have the ability to screen consumers, families, individuals for any publicly funded assistance program that they may have eligibility for, and then help them overcome any barriers to get into those programs. So whether it be the health insurance marketplace, Hillsborough County Healthcare Plan, Medicaid, Florida Kid Care, we are going to assist them with those applications ourselves, any of the navigators, and then ensure that they get into those programs for whatever reason, if there's any challenges or barriers. Beyond that, we also provide community agency trainings to professionals to ensure that social workers, teachers, school nurses know about updates to healthcare policies and program changes so that they can be as ready as possible to provide updates to the families that they serve. And then we also convene a coalition of assisters in Tampa Bay who are dedicated to ensuring that Tampa Bay residents have access to coverage. So beyond the navigators, there are certified application counselors, financial assistance counselors, all people who are invested in ensuring people have access to health insurance. And the Covering Tampa Bay Coalition meets quarterly to receive updates and identify new information that's important for the general population or the general social service agency and community to know and understand. And we do more, as I mentioned, than just getting applications submitted for health insurance coverage. There's a lot more of a holistic view that we're able to provide support to. So explaining medical bills, scheduling clinical appointments if people have difficulties doing that themselves with them, application technical assistance. So answering questions as to why an application had an error, helping families and individuals upload documents to ensure that they're correctly submitted in case an agency is asked for additional documentation, understanding additional health insurance literacy. So what's a deductible, what's co-insurance, and sitting with a family or a person and helping them understand the differences of those. And then if needed, if we recognize that there is an additional need for that person in the moment of helping them with their healthcare coverage program, we'll also go on and assist them with other social determinants of health. So if there's a SNAP application that's needed, we'll assist with that as well. Sometimes called food stamps, SNAP application, or WIC as well. So it's not just going to be somebody sitting and completing a document or an application online, really looking truly at the health and wellness of the individual we're serving. And for the Family Healthcare Foundation, we are one of, and I'll talk a little bit more, we're one of a statewide coalition of partners. So we cover the Tampa Bay area under this Covering Florida umbrella. But where I feel our strengths truly reside is that we have a comprehensive assessment tool so that anybody we're assisting in whatever space or whatever platform, whether it be in person, whether it be virtual, we screen every single person for any of the programs they may have eligibility for. And we show them or tell them what their options may be, whether it be Hillsborough County Healthcare Plan or the Health Insurance Marketplace, and then assist them with whatever program they want to move forward with. Sometimes people have overlapping eligibility coverage. They may have the ability to go in one program or another. We let them know all of their options or the reasons as to why a program is not an option, and then help them move forward with the process. In addition, we have a family advisory council that we meet with and we convene quarterly with, that are members of healthcare coverage programs that we assist with. And so we hear from those family members as to what are the challenges or problems or barriers to accessing care, or positives of the programs as well, so that we can go back to the agencies that we're providing application assistance for, and let them know what those challenges are if they're not hearing them themselves. In addition to that, and something that I think the Family Healthcare Foundation is one of the most proudest parts of our work and our strengths, is we have an experienced and stable workforce. So many of our navigators have been doing this for almost 10 years. This will be the 10th open enrollment that we're going into for the health insurance marketplace. So we have an incredibly, the knowledge is incredibly robust. They've seen the nuances and changes. They've been there from the beginning of some of these programs being available, and they're there to be able to train a new workforce as well. So we haven't lost that knowledge, which has been critical for us, as we've recently tripled our staff size due to support from the Biden administration that was recently released for the Navigator funding. And beyond that, as another strength, our Tampa Bay partners, we could not do the work that we do without the community agencies that we work with collaboratively. And I want to talk a little bit more about each of these and kind of give some examples as to how these partnerships have worked out for us. And there's sort of two different parts for the Family Healthcare Foundation. So we are a 99.9% grant funded organization. So all the work that we do is completely free to the community, because we are funded by federal, so we're subrecipients of federal aid dollars. And we have direct state funding, local funding through county government, and also through the Children's Board of Hillsborough County. In addition, so there's that. And in addition to that, we provide funding to currently 4 agencies. BayCare Health System, which we've worked with for a decade now. They have navigators who've been at BayCare for a decade. Now, most recently, Tampa General Hospital has navigators on site at the hospital location in their financial assistance department. Premier Community Healthcare Group, which is in Pasco and Hernando County. They are a federally qualified healthcare center. And Evara Health, which is the federally qualified healthcare center in Pinellas. So they also have 2 navigators at their clinic locations as well. So the top level of the Tampa Bay partners, there is a financial component where we're funded by USF. We provide additional funding to these agencies. So we work really closely on a weekly, monthly basis, ensuring all of the navigators, all the 32 navigators in our Tampa Bay Navigator project are highly trained, ready to go, and made aware of up-to-date information. But beyond that, we have other community partners where we are providing services either on site or as a referral source for them, or they are referral sources for us. And that work cannot be, I don't know that those relationships can necessarily be quantified or a dollar amount can be put on it, because it's incredibly valuable and productive. So for example, the Children's Board Family Resource Centers, we are on site at 7 in Hillsborough County, Children's Board Family Resource Centers. And many times, this is one of the first places that families come to when they get to Tampa or when they get to Hillsborough County, either through word of mouth or another social service agency has referred them. Generally, families with young children who need insurance, who don't understand why they can't get to the doctor. They don't know how to get their kids registered for school without health exams on file. So our navigators are able to be at each of those locations across Hillsborough County, which is a phenomenal way for us to get access to families who need coverage for their kids. Feeding Tampa Bay, we've had just tremendous fortune in working with them, as well as the navigators at BayCare work really closely with them, especially this last year. We've been able to train their Fresh Force program, which is a job skills training program. And immediately after those trainings, sit with each of their students and do usually applications for Hillsborough County Healthcare Plan. or sometimes the health insurance marketplace, depending on the eligibility for that individual. Catholic Charities of St. Petersburg, I'll show an example of some of the impact of that work here shortly, but we've been on site at their homeless stabilization unit called Tampa Hope every Friday since January, just helping out with any healthcare plan application that we can do for their population of residents. And then beyond that, we've just had some really innovative partnership opportunities in this last year. Idea Exchange is Tampa General, USF Health, Pioneer Medical Foundation's needle exchange program. We're on site there, giving out information about affordable healthcare coverage to people utilizing their services. Ready for Work Hillsborough through A. Brown Ministries. They've got a re-entry program that is for people who are recently released from incarceration. That is incredibly important because this is a population of people who were served with medical care for the duration of incarceration and then immediately lost coverage upon leaving. So we're able to connect to make sure that they're getting into whatever program is most appropriate. Redlands Christian Migrant Association, their teacher population is generally eligible for health insurance marketplace. And then Healthy Start Coalition, we're assisting with complex Medicaid issues for pregnant mothers who are needing access to prenatal services. I'll pause here for questions if anyone would like to ask any. I'm always very excited about sharing about all the different ways that we've been able to partner with really impactful social service agencies in our 4-county area.
There is a question in the chat.
Thank you.
How do you reach out to clergy?
So that is a great question. So the faith-based community at this point, that is an area that we're going to put on our thinking caps very hard, because we've in the past, years ago, there was a lot of statewide energy around Methodist churches and their congregations around the state. But as of today, we have not had a wide network of faith-based organizations that we've been able to truly engage with. We've had one-off churches, a couple of temples, but if there was a wider network, then that would be phenomenal, because that's a huge part, a huge population of people that I think would want to hear from us, and we'd be so excited to serve. Very good question. Was there a follow-up question or no? That was it?
The question was for me. This is Deb Kaufman. My husband is a Lutheran pastor who's served congregations in Hillsborough County and knew nothing about your services. And, you know, there are still people who come to the church, many churches, I'm sure everywhere, who are looking for help for all kinds of things, including this, where, you know, so I guess what I'm trying to say is even just letting them know through, you know, some sort of mailing or email or something that you do what you do, I mean, would be very helpful to them, I think.
I agree. Yeah, I think what we've noticed, I mean, what I believe we found to be the most helpful is sometimes when you find a network, a connective network of people who are engaged together, for example, like the League of Women Voters, or, you know, there's a network involved, and if we can somehow have that top-down approach, because individually, it's more difficult. Like, for example, when we work, and I failed to put them on this list, Hillsborough County School District is an amazing partner of ours. And we work very closely with their employee benefits team, with their school social workers, with their school nurses, which is a far more impactful way for us to get information out instead of going to every single school, and which we'll do if we didn't have the top-down approach. But I will say that the faith-based community is one that we are absolutely going to target this upcoming year, because it is so important. So thank you for that question. Oh yeah, okay. So I'll share just again a little bit about Tampa Hope in particular and why I just think it's phenomenal. And I am going to share a little bit about all of the healthcare programs that we work with, but this is the Catholic Charities of St. Petersburg homeless stabilization facility that is in Hillsborough County. They have a comparable one in Pinellas as well. I believe the intention is at any given point to stabilize 200 chronically homeless individuals. And eventually they will have cottages that are air conditioned, and it will provide a safe place that has access to multiple social services, caseworkers, medical care, and healthcare navigators who will help get people access to whatever healthcare plan will be the best fit for them. Usually for people who are without any income at all, it will be in Hillsborough County, the Hillsborough County Healthcare Plan. But we will frequently see people having issues with health insurance marketplace, or if they're working, which some people are, there might be other programming like the marketplace that's a better fit for them. But this one in particular is a community partner that I am very, very excited about. We've been there since January. For Hillsborough County Healthcare Plan in particular, I think it's a phenomenal location for us to be at. And as we've about doubled our staff size in a year. And as we continue to grow in capacity, I would like to see us there more frequently because I think it has a lot of potential. And it's a population that really needs access to healthcare coverage. So additional opportunities, as I mentioned, we cover 4 counties, Hillsborough, Pasco, Pinellas, and Polk. But this is a statewide issue that'll be affecting many people. So the end of the public health emergency and redetermination of Medicaid eligibility. So just kind of a little bit about the public health emergency. So of course, in 2020, with the onset of the COVID-19 pandemic, a public health emergency was issued by the federal administration. And in that moment, there was a pause for Medicaid redeterminations. So here in the state of Florida, every year, someone has to reapply for Medicaid. It's an active process. So updating an application, resubmitting income documentation. And if that person is getting other benefits like SNAP or food stamps, they actually probably have to resubmit an application every 6 months. So there is a little bit of an administrative churn that occurs generally, where people are coming out of the Medicaid population because they didn't update their account. They didn't submit the documents on time. Or their eligibility has changed. They're earning different income. So with the public health emergency, there was a pause to all of that. And so since the spring of 2020, so really getting up there in the years at this point, we've had a growth in the Medicaid population in the state of Florida, but considerable growth. And so as the public health emergency begins to come to its end, which the Biden administration has acknowledged that it will, the different state agencies and sister communities, everyone is preparing now for the Medicaid unwinding. So what would that mean? It means that at some point and in some fashion, all of the people who are currently enrolled in Medicaid will need to reapply for Medicaid. And I'll show numbers on like what that impact might look like. So the federal government has pledged to provide states at least a 60-day notice before the end of the public health emergency. And we thought it was going to occur August 15th. However, it did not. So we then believe that the notice will begin on October 15th. So a 60-day notice. So at this point, all signs point to a Medicaid unwinding as beginning on February 1st. Does anyone have any questions there? Okay. So just to kind of put some numbers to that, it's believed at this point, based on past trends, that 17.4% of existing Medicaid and CHIP enrollees will leave the program. So that's of existing. So that's approximately nationally about 15 million adults and children will leave the Medicaid program. And 7.9 of those are going to be leaving that program. So 6.8 million adults and kids, they'll be removed from Medicaid due to what I mentioned earlier, administrative churn. So they're still eligible, but they didn't update their account with the income documentation. They lost their username and password and couldn't do the application in time. So they're still eligible. So they could potentially go back into Medicaid. But then 9.5%, 8.2 million, this is national numbers again, they actually are no longer really eligible for Medicaid. They got a new job, the kids aged out of coverage, income changed dramatically. They need to go to a different program simply based on the income eligibility. So a couple more numbers, and don't look too hard at them, but based on, and this is projected. This is based on looking at the most recent enrollment numbers for the state of Florida by counties, and then using that projection of the percentages that was made available by Health and Human Services. So for each of the counties that we cover, there's almost about 1 million people who are currently enrolled. Of those, we believe that over 150,000 of them are projected to lose Medicaid coverage. 76,000 of those should still be eligible for Medicaid coverage, but over 91,000 need to go somewhere else. They need to be in the correct program, and there will not be a seamless transition of getting them to that program. They could be eligible for Hillsborough County Healthcare Plan if they're in Hillsborough County. If they're kids under the age of 19, they could be eligible for any of the Florida Kid Care programs, subsidized or full pay. Or they very well could be likely eligible for a health insurance marketplace plan. But the most important part is that they may not know that they've lost their Medicaid coverage until they go to utilize their coverage. And so what I've really tried to point out in discussing this is that unless people know, unless people are hearing it from everywhere, they may not know until it's too late, and they're going to access medical care in an emergency or in a crisis, or when they are going to get a surgery that they thought was going to be covered through their Medicaid. And so currently, while we wait for this Medicaid winding to be announced and hear from the different agencies that are involved in that process, what the timeline looks like. Will they do it all at once? Will they phase people into an application process? We're trying to ensure that people know that there's other programming that they may qualify for. Any questions there?
I have a question. How are they going to know this? I mean, if they're canceled, what do they do? Where do they go? And if they don't know about you, I mean, they're just kind of left helpless.
So they will receive a letter. So the messaging that we have right now, that some of the federal agencies have listed right now, is that everyone should update their contact information through the state agency that administers the application process. Update your contact information to ensure that whatever communication comes from the state agency when you are asked to reapply gets to you. Because almost 3 years of not having had to update an application, people may have moved, they may have had their phones turned off, PO boxes might be unchecked. But a letter would come from the state agency that will be redetermining benefits, asking people to apply, asking people to renew their application. But again, there's this concern that if they've had a change, that they may not receive it in time. But we are about to launch on a pretty high level. Well, we are about to launch on an advertising and marketing campaign that will hopefully promote our services as much as possible to the communities we serve. And we are trying to share this information as much as possible with other agencies and community partners to see if they can share it out as well.
So when they receive this letter, is there anything about navigation services or how to? No, there's not.
Not at this point. No, not at this point.
Thank
No, not at this point. There likely will be information about the health insurance marketplace and Florida Kid Care, about the programs themselves. But that's a very good question. So lovely question in the chat. How many of these people do you have enough staff to help in Hillsborough County? So we currently have 16 staff members for the Family Healthcare Foundation. And then through our partners that I mentioned, BayCare, Premier, Evara, Tampa General Hospital, for a total of 32 navigators across 4 counties. And we will likely be hiring additional, some additional staff as well. At this point, we are not at capacity. We have opportunity still. We are not 24/7. But I think what's important is that, as we build awareness around this, Yeah, we have capacity at this point. What I think we don't have is public awareness of the services that we provide for the Family Healthcare Foundation, or the importance of a free, unbiased navigator compared to, well, yeah, just a free, unbiased navigator. That's a great question. Thank you so much. Let's see. Oh, and here we go. So as anybody invested in spreading information about this, ensuring people have access to affordable healthcare, ensuring people aren't caught off guard thinking that they had Medicaid when they don't, we're asking that people spread our contact information, resharing any posts that people see on any of our community, our social media sites or our community partner sites, really promoting open enrollment, which is coming up soon and I'll share more about. And generally spreading our contact information of the navigators. We are so fortunate, as I mentioned, to have just an incredible team of people working with us, not just at the Family Healthcare Foundation, but through all of our partner agencies. We have navigators who speak English, Spanish, Haitian Creole, and Portuguese. And I'll show a little bit more about how easy it is to get people connected with an appointment. To mention open enrollment, so this is the health insurance marketplace, federal government's platform to shop for insurance and also apply for financial assistance, compare plans side by side. It starts November 1st and it goes to January 15th. We're not sure yet about this upcoming year, but this last year we had 7 different insurance carriers in Tampa Bay alone and over 160 plans to choose from. So while that's very exciting that there's so many options for people, it also may be a little overwhelming. So to know that there is someone who is truly just invested in getting people access to the best care that they believe is getting access to the best care that the individual is deciding to choose, that would be us. Navigators are truly just hoping to help with understanding the information and letting the person shopping for coverage make the best informed decision too. And beyond open enrollment, we are always here as well. And we are not just working during the health insurance marketplace open enrollment. And what's also so great about the Family Healthcare Foundation and our partner organizations is that if someone is not eligible for a health insurance marketplace subsidy, an advanced tax credit that reduces the premium cost, we can easily show the Hillsborough County Healthcare Plan or the Pinellas County Healthcare Plan or the Polk County Healthcare Plan to them, or connect them in Pasco to a federally qualified healthcare partner who can provide services on a sliding scale. So we won't just leave them with nothing. We'll walk them to the next best option for them. And as I mentioned, it's fairly easy to get to a navigator once people know who we are. And on our website and on the statewide covering partner Florida website, we are able to get appointments to people based on zip code. We offer appointments virtually via Zoom, over the phone, and in person. We have probably 15 different in-person locations ready for open enrollment and a bunch of different enrollment events where we'll be having a bunch of navigators available for in-person assistance. So all of those are available on our website or on the Covering Florida website as well. And as I mentioned, we are part of a larger consortium. I had the honor and privilege of actually working at the University of South Florida, working on this project for the statewide agency for about 4 years before transitioning to the Family Healthcare Foundation directly. And there are amazing people around the state in each of the 67 counties that Florida has doing this work just like us, free, confidential, unbiased. And we are all very well connected and stay in touch. So if anyone would like a warm introduction with their local navigator grantee outside of Tampa Bay, I'd be happy to facilitate that. We have very active social media. So for anyone who's interested in finding us on Facebook or Instagram, we also have a LinkedIn. And we really truly love showcasing the work of the navigators. We will go to any community festival or event. We'll share tips about affordable healthcare coverage, promote different programs that we assist with. So yeah. And as I mentioned, we have navigators who speak English, Spanish, Portuguese, and Creole. And so the goal would be that if anybody calls our main phone number, they can get to a navigator that speaks a language that they speak. And if for some reason we don't have a navigator who speaks that language, we have access to translation services as well. So I'd love to open it up for any additional questions, or if there's a particular program that someone would like to know more about, I'd be happy to share that as well.
I thought there had been a question in chat from Deb about the budget. Did you see that?
The question is, what percentage of your budget do you have access to for outreach?
So most of our work includes, I can't say off the top of my head, but I will say that for navigators, when we got the Affordable Care Act, when the Affordable Care Act was issued and this navigator role was identified, we had two benchmark requirements or two benchmark charges: application assistance and outreach. So it's truly like a two-pronged approach. And that's for the Affordable Care Act navigator side of our work for the marketplace. Each of the respective contracts that we have an earmark for outreach work. But I will say that the time of the navigators attending outreach isn't necessarily, like, there's outreach for fees and advertising and health fair registration fees, but that doesn't mean that we can't send a navigator out to do door-to-door outreach and share flyering at libraries. That technically is outreach, but it's not earmarked in a budget as outreach, if that makes sense.
There's now a request in the chat that you back up to the slide with the healthcare.gov dates again, please.
Sure, absolutely. And this open enrollment period, so open enrollment November 1st, January 15th. So for example, let's say somebody chose COBRA. They left their job. They didn't really think the marketplace was for them, or they hadn't thought about it, or they just were, really overwhelmed because they were, let's say, retired before the age of 65. They were 62. So they chose COBRA and they're paying like $700 a month through their former employer. So, okay, open enrollment comes around through the marketplace. This is the time to look. Like, look, if you're in COBRA, like, look during open enrollment, see if this is a better fit for you. Now, if there's another event, a qualifying life event, someone gets married, has a baby, loses their job, moves, open enrollment really is not, it's not the end all be all. There's these special enrollment periods, just like with employer sponsored insurance, that would let someone go into the marketplace for the first time. And I think sometimes that's one of the biggest shifts for people to think about when they think about the health insurance marketplace, especially if they're coming from more of the employer sponsored world. Some of these things are very much the same as like the qualifying life event part. So, and this did change recently with the change in federal administration. It had been reduced to November 1st through December 15th, but it was extended.
Could you give a little bit more detail about the differences between what's available in each county?
I would love to. Thank you for asking. So I will go by this little guy. So in Hillsborough County, we're very fortunate. We have a couple of different amazing programs. If we have a resident calling from Hillsborough County, well, the first thing we do is we'll ask somebody, where do they reside? What county are they living in? So based on their income, someone may qualify based on their income and also based on a couple other categorical factors. Someone might be eligible for Medicaid, not very many though. Not a lot of adults qualify for Medicaid. They might be eligible for the health insurance marketplace, depending on their income. They might be eligible for Hillsborough County Healthcare Plan, Hillsborough County's Comprehensive Managed Care Program for those who are considered lower income. Or if it's for kids, they might be eligible for 4 different Florida Kid Care programs. So Florida Medicaid for kids, Florida MediKids for kids, Florida Healthy Kids, and then there's also the Children's Medical Service Network, Children's Medical Services, which is for kids who have complex and chronic medical needs. So it depends on a variety of factors. age, age and income. Every once in a while, immigration status might play into that as well for the adults. So that's Hillsborough County. Pasco County, we have to remove one of those. There is no safety net program in Pasco County like there is in Hillsborough. So for Pasco County, we would be looking at, again, that Florida Medicaid, not a ton of people qualify as adults. For the health insurance marketplace, for the kids, same thing, Florida Kid Care. And if for some reason someone's income is too low for the federal financial assistance, because the premium tax credits are a federal subsidy, someone's income is less than 100% of the federal poverty level, they are not eligible for the federal tax credit. They're in what's called the Medicaid gap. And since in Pasco County, we don't have a safety net program, unfortunately, we're very fortunate to have an amazing partner like Premier, federally qualified healthcare center that provides primary and some specialty services. But there is no safety net program in Pasco County, unfortunately. Pinellas, there is. So similar to Hillsborough, there is a, we could look at the marketplace, the Pinellas County Healthcare Plan, Florida Kid Care, and then Polk County as well. Polk County, we could do marketplace for adults. There's a Polk County healthcare plan that we can help connect people to. For kids, the same thing with the Florida Kid Care. It's a statewide program. And then again, smaller adult population for Medicaid. But I will say that for any person we speak with, we are doing a screening assessment for all of those programs to see which program is going to be the best fit for them. And if they qualify for both, like in Hillsborough County and the marketplace, there's a little bit of an overlap. We'll let them know about these two different options for them and decide how they want to move forward.
Thank you. So I think Deb was trying to ask a follow-up question before on the outreach, and she wasn't able to get her mic to work. And so she has it in the chat. She just wanted to confirm that there actually is no staff dedicated to outreach or marketing. So all your navigators are navigators. Is that correct?
Yeah, I'm a navigator. Yep, all of our navigators are navigators, correct. So we have 16 staff members. I started off in 2013, I believe 2013, the first year of the marketplace as a certified application counselor, working at a medical case management agency for the Ryan White population, so those who are HIV positive. So that was the first year of the health insurance marketplace. And then about a year and a half later, I transitioned over to the statewide program office, doing the statewide, covering Florida project management. And so while being an executive director is phenomenal, and I love it so much, many of us have been doing it for 10 years. And so even from our director of operations to other staff, everyone maintains that navigator title and is required to do appointments. Now for marketing in particular, we do not have a dedicated staff member, administrative staff member who does marketing. Recently, we've taken that a little bit off my plate and put it on to, we have a marketing firm that we've engaged with. That's that's part of our budget. But we were a pretty lean, mean nonprofit team for many years. And so, and we do also have to be within the purview of the funding contracts that we get as well. So
now that your bandwidth has grown and you might have the ability to reach out to clergy or other access, you don't really have a person that can follow up on that easily, right? You don't have the bandwidth on the marketing side.
Well, so what we do have is we have program coordinators. The way the organization structure is that we have for the Navigator project, we have for the Marketplace Navigator project, we have program coordinators who are tasked with leading each county. So they find events, they engage with community partners, and they follow up or assign staff members to follow up with new partner agencies. So we do have leadership in that way to kind of lead the programming for that work. So that's kind of a little bit more of the organizational chart part of it. I will say, I believe we do have the bandwidth now. We do have the capacity. And part of the issue is that we began, Family Healthcare Foundation as the Navigator grantee for the Tampa Bay area began in 2013. And there was tons of emphasis around promoting the health insurance marketplace, like Health Insurance Marketplace Affordable Care Act. Like that was a huge deal. But what was happening in the background is that everyone was learning about all of the different healthcare programs because we are in a Medicaid gap state. We couldn't put everybody into the marketplace. We had to identify other safety net programs for the people who weren't qualifying for the federal subsidies. And so we became much more than the health insurance marketplace or Florida Kid Care. We had to become a really deep end navigation agency for all the different healthcare resources available. And so while that was happening, we were getting smarter, we were getting up to speed. But then in 2016, our budgets got slashed. 2017, our budgets got slashed by 85% with the change in the federal administration. So there was tons of support for navigators for the first couple of years, but then we just had the wind sucked out of us. So we were still there, but we were a skeleton crew. And so now when we are doing presentations or out in the community, people always say, oh, I thought you went away. I thought navigators were gone. It's like, well, we weren't. I mean, we felt like we were a little bit, but we really weren't. We were here, but we didn't have any ability really to get out the marching band. And so now we're getting out the marching band. We're getting back to rallying. So that's where I'd say things like, we have the bandwidth, we do have the capacity, we have the staff now, we can respond to the needs. It's just making sure that we can kind of get through the white noise of everything else that's out there, the pandemic, natural disasters. Very good question.
Does anybody else have a question?
You-
Celeste,
Kate-
I think Celeste
Oh.
has a question.
Okay.
We can't hear.
Oh no.
We can't hear you.
It might be the audio might not be connected because of the headphones. Maybe, I could be wrong.
Yeah, we can't hear.
Can she put it in the chat, her
I
question?
don't know. Okay, are you going to type in the chat? Okay.
And Lori, I see your question about the Hillsborough County Healthcare Plan. Dr. Curran asked that question when I presented on the management committee. And these are my suspicions. I don't know. So, I mentioned with the public health emergency, we have this huge growth in Medicaid enrollments. So for the last almost 3 years, nobody's had to redetermine Medicaid. So let me go back to this one slide. Hold on a second. So I don't have the most recent data for healthcare plan enrollments, so I don't know that this will make a huge impact, but we have like 60, maybe 70,000 people who we believe are going to be kicked off of Medicaid through this end of public health emergency. So 32,000 are probably still eligible. I'm going to bet probably a lot of those are kids. They're probably a lot of that is kids. But almost 40,000 people need other coverage. So that's Hillsborough County. I mean, that's probably going to be a lot of Hillsborough County healthcare plan members. So I do think that a lot of that downward trend may be due to that. Is it the bulk of the reason? I don't know. But I do think that there's a pretty considerable number of people that would be qualified applications for the Hillsborough County healthcare plan once people are effectively kicked off Medicaid. And I will say that the other issue is that people don't know about the Hillsborough County healthcare plan. They just don't know. And I mean, we all know that unfortunately is the case. And so when you tell people about it, they're in disbelief. They can't believe it because it's such a phenomenal program. But that's why I think being innovative, like going to places where you've got a captive audience of people who could qualify. So the recently released from incarceration, places that have chronically homeless individuals that are consistently there, like Tampa Hope. Hillsborough Community College, the USF population, like these are places that people they're not required to have insurance, and they also aren't offered to have health insurance by those academic institutions. So if there could be a more targeted outreach for those, that would be, I think would be really helpful.
So Celeste put her two questions in the chat. One, she said this is a very interesting program and she's interested in finding out how to be a navigator. But her first question was if you could maybe explain why Pasco doesn't have a safety net, maybe help us understand how the other ones were developed. Obviously, we're an advocacy organization, so if we can help Pasco have one, how long have the other counties had the program? How did they get it started? Is it county commission? Some of that.
Yeah, for the Hillsborough County Healthcare Plan, it was passed over, that was a Board of County Commissioner decision that was passed over 25 years ago. It's funded by a 0.5-cent sales tax. Unfortunately, I can't speak to Pinellas and Polk County at this point, but I can follow back up about that. I'm a little bit more familiar with Hillsborough counties, mainly because we do direct enrollment assistance for them. With Pinellas and Polk, it is a warm referral to that application and to those caseworkers. But it is generally it's something that's funded by local county government, so it would need to go to a board vote for that. And there would have to be resources at the county government and invested champions to make sure that that plan or that program gets off the ground.
So are there volunteer navigators or only hired navigators? And so if you're hiring new navigators, would that be on your website?
There is currently, yes, we do currently have part-time positions. We kept it to part-time mainly because we've got a pretty robust staff that as it is. We want to ensure they're productive and busy. Some people are interested in part-time work, and we are looking primarily at some evening and weekend availability too, to complement some of the work that we're doing. So currently part-time navigators. I believe USF had a navigator or two position posted, and I also believe there might be 1 or 2 navigator positions full-time available with our BayCare partner as well. We don't have volunteer navigators, unfortunately. Every person has to go through a level 2 background screening, and there is the potential for a lot of PII, PHI, public health, private health information to be discussed during an appointment. So because of that, we limit it to hired staff members.
Any other questions? Lori, do you want to wrap it up?
I do. I have to say, thank you so much for doing this and making us aware. I don't know what we can do to help you. So if you have insights, you can share that with us. Maybe not tonight, but you can think about it. And we would like to help expand what you do and make people aware. So I thank you for taking the time to educate us and inform us. We would love to be able, because we are advocates, we would like to be able to continue. And we appreciate your time and effort in answering all these questions. Thank you. Thank you.
Thank you. It was an honor.